Medicare Part D is your prescription drug coverage. A lot of people are overwhelmed by it, confused by it, trying to figure out which is the right plan for them. So I'm going to slow it down, do a little bit of a long form video here. Click here if you want to connect, and let's discuss. So first, if you want prescription drug coverage, which I highly recommend you get, you have to sign up for that separately from when you initially sign up for Medicare Part A and Medicare Part B. If you go original Medicare, it's a standalone plan, and if you choose to go Medicare Part C, Medicare Advantage, you can have the Part D built into your Medicare Advantage plan. Now, no one's forcing you to take Medicare Part D, but if you don't take it when you're first eligible and then you sign up later, there will be penalties assigned to you that stay with you forever on top of the monthly premium that you may be paying for this plan. So now let's get into the nuts and bolts of this. Each year during the Medicare annual election period, you have the opportunity to review your Part D coverage and figure out if it's going to be the right coverage for the next calendar year. The plans change annually. Your drugs may be a preferred drug on the list of that plan, and next year it's not. So there's always reasons to look into this and just make sure that you are going to be covered properly. The difference between one plan and the wrong plan could be thousands of dollars. It could be a big difference, making sure that your drug is properly covered under the plan you've chosen. So the simplest way first to go about this is either you're working with an agent who helps you navigate it, or you could go right on to medicare.gov and do it yourself. So you could go to medicare.gov, and on the opening page of the website, you're going to see this as an option: find health and drug plans. And then follow the prompts. They're going to ask your zip code, your medications, your preferred pharmacy. Most of these drug plans, or all of them, contract with pharmacies, and with some pharmacies you're going to get a better price on your prescription. So you want to go to a preferred pharmacy. But in the meantime, like I said, follow the prompts. And once you've input all your information, you're going to see a list of medications. The list is going to come out in order. So this is just an example. I happened to I was looking at this WellCare plan, and you could see in the zip code that I put in, that's the monthly premium. But right below it is what you really care about, and it says retail pharmacy estimated total drug and premium cost. So you can see from that number what it's going to cost you for the year. That includes premium and the co-pays or co-insurance that you have to pay. And what happens on the website is they they list them in order. So you look at that. But still, that's the simplest way to look at it, and a great way to do it. Look at what's going to be the most cost effective. But people always want to understand the deductible, the different phases. So we're going to take a minute here and we're going to look at this. So here's a chart that I made on my computer, or just something to kind of walk us through it. I'm going to be looking down it a little bit to read it, but the bottom line is the first thing is you're going to have a plan monthly premium, and that premium is going to vary from company to company, plan to plan, zip code to zip code. So whatever that premium is, that's what you're responsible to pay monthly. Now, a lot of people may think, here's a $10 premium. That looks better to me than a $70 premium. But remember, in that image I showed you before, you want to look at the total, because a $10 premium, if the drugs cost $3,000, and then that may not be the right plan for you. You want to choose based on that big picture. Maybe the $60 premium, the drugs are free, no copays. So you got to look at that, and that's why you look at how the cost is in order based on how it shows on the website. So with the deductible, typically you have to meet that amount before the company is going to help pay for any of your drugs. But I'm sure you've heard this. The drugs are all classified based on tiers. And some of these plans with tier 1, tier 2 doesn't count towards the deductible. So you may be confused, why are they covering some of my drugs at zero cost when I haven't met the deductible? Well, that is the reason. And even when I started doing this, I was confused by that until I really started to understand the nuts and bolts and how these plans work. Now, you're going to see some plans with very high deductibles and some plans with lower deductibles. And again, You're not choosing it based on that. You're choosing it based on the big picture of what it's going to cost you for the year. But typically, the plans with the low monthly premium have high deductibles, and typically the ones with higher monthly premiums have low or no deductible. And that's going to impact how the amount you pay each month. And so in a high deductible plan, if you had a higher tier drug, you're going to get hit with a bigger cost right off the bat, but then maybe it levels out. So now let's say you've met your deductible and you fall into now the initial coverage. That's that second phase. And what's going to happen during that phase is you're going to pay a copay or a co-insurance. And each plan defines what it is. So it's just an example of me, but maybe a tier 1 drug, which is a preferred generic, is a $0 copay. And a tier 2, maybe it's $2. Tier 3, you're paying 25% of the cost of the drug. Tier 4, 50%, so on and so forth. And every plan is going to look different. So you pay your portion and the plan pays its share. And what happens is when you and the plan together have paid $5,030, and that includes the deductible that you've paid, that you then move on to the next phase. Now, I know that sounds like a lot, but the plan is actually paying a lot of that money. So it's not that you have that amount that comes out of pocket. It's a combination. So the next thing that happens is once you've met this amount between the combination of you and the plan, then you go into what's called the coverage gap. It used to be referred to as the donut hole. And what they're saying is that you stay in this section, this phase, until the total out of pocket is about $8,000. So what happens in that phase? You pay no more than 25% of the cost of generics and brands, but you get credit for 95% of the drug cost. So about 70% is going to be paid by the manufacturer. So again, that number sounds daunting, but it's really not out of your pocket. It's a combination of your pocket and other pockets. So when you look at this, you stay in this phase. And so that means here, if they're saying 25%, maybe when you were in the green tier, you were only paying, X amount of dollars, and now it's gone up because you're paying 25%, or vice versa. Maybe it cost you less in the green tier, but that's why your prices move all over the place. But again, what happens here is you stay here until the true amount out of pocket is $8,000. So what makes up that amount? And again, I know this is confusing, but you want to learn this, I'm going to teach it to you the best that I can. So the troop is the deductible, the amount you paid in the initial coverage stage, and it's the amount you paid, not the plan. So the amount you paid for these different tiers, and then the coverage gap, that's the 25% you paid plus the 70% plus the 70% of the brand name cost paid by the manufacturers. So that's how it all gets added up. And when you get to that number and you go to the catastrophic phase, you're not paying anything because they eliminated the 5% copay that existed or co-insurance that was existing in 2023. So what I'm reading is that the most you're going to pay out of your own pocket is somewhere between $3,200 and $3,300 if you're somebody that's going to land in the blue catastrophic area. So did this clear this up? I don't know. I know this is very confusing, but the point here is you can take some time to understand these 4 phases, or what you could try to understand really is that you want to choose it based on the total amount out of pocket. And when you have drugs in higher tiers, they can be more expensive. They're typically defined by 6 tiers. And if you ever add a medication mid-year, you can show your doctor your formulary, your fancy word for drug list. It defines it. So if there's 5 blood pressure meds offered and one is a tier 1 and one's a tier 3, your doctor can prescribe the tier 1 drug. So full circle, I don't know if this helps, but at least it gives you an idea of understanding all the terminology being thrown out there, while you should focus on the big picture, what's your total out of pocket, choose the most cost-effective plan.